Today, we're all running around caught up in our daily routines, and sometimes we don't even notice the little messages our bodies are sending us. So, do you think you've got a moment to spare and just listen to what your body might be saying? Hello, and welcome back. Today, we're going to talk about the common 8 signs that give you warning about the low level of oxygen in your body. So, let's get started. What exactly is hypoxemia? Hypoxemia is a condition marked by lower than normal oxygen levels in the blood. Usually, it bears notable implications for bodily function. In cases where blood oxygen saturation dips considerably, it can compromise various physiological processes. An individual grappling with diminished blood oxygen content is medically categorized as hypoxemic, whereas the genesis of hypoxemia can be traced back to disruptions in either oxygen intake or its efficient delivery to the blood. The harmony between unobstructed airflow and effective blood circulation is pivotal in sustaining optimal oxygen levels in the bloodstream. This complex interplay explains why both pulmonary and cardiovascular disorders escalate the susceptibility to hypoxemia. And when we talk about the levels of complexity of hypoxemia, then it's considered to have ranged from mild symptoms to severe consequences. Minor signs may include headaches or an increased sense of breathlessness. However, severe cases can have far-reaching impacts, interfering with the harmonious functioning of vital organs like the heart and brain. In context with its symptoms, hypoxemia can manifest in varying time frames. In some cases, it might be an acute or chronic respiratory failure. 8. Shortness of breath. Feeling short of breath due to hypoxia, which refers to insufficient oxygen levels in the body's tissues. It occurs as a result of physiological response aimed at addressing oxygen deficiency. Surprisingly, this reaction is your body's way of adapting to the situation. When your body detects that there's an inadequate supply of oxygen to meet its needs, it triggers a sense of mechanisms. First, the brain continuously monitors oxygen levels and recognizes that the tissues aren't receiving the required amount of oxygen for optimal functioning. Consequently, it sends signals to the respiratory system, promoting it to increase both the rate and depth of your breathing. This is the reason the sensation of being short of breath in response to hypoxia serves as a protective and adaptive mechanism. Gradually, your body is making an effort to augment the oxygen supply to your tissues and concurrently expel waste products. It's important to bear in mind that although this response is initially advantageous, in long-term scenarios, it may lead to severe hypoxia that can have detrimental consequences on your overall health. 7. Rapid breathing, tachypnea. Rapid breathing, also known as tachypnea, is a common response in the presence of hypoxia. In simple words, the increased breathing rate serves as a critical physiological adaptation to address oxygen deficiency, whereas this whole process reflects your body's remarkable ability to adapt and respond to changes in its environment to ensure its survival and optimal functioning. So guys, if you find yourself consistently experiencing rapid breathing or suspect low oxygen levels, it's crucial to consult a medical professional for accurate assessment and appropriate care. 6. Confusion or cognitive impairment. If you ever experience confusion and cognitive impairment due to hypoxia, then it indicates low oxygen levels in the body's tissues. Undoubtedly, it's a result of the brain's vulnerability to oxygen deficiency. So, let me be real with you, my friend. As you know, your brain is an energy-intensive organ that relies heavily on a constant supply of oxygen to function properly. So, when oxygen levels drop, as is the case with hypoxia, the brain's ability to perform its various functions becomes compromised. In all of these situations, confusion and cognitive impairment in the context of hypoxia stem took place that demands a high level of oxygen to perform body functions properly. Oxygen deficiency disrupts energy production and neuronal communication, impacting cognitive functions. If you or someone you know is experiencing confusion and cognitive difficulties, especially in situations involving reduced oxygen levels, seeking proper medical attention is crucial for proper evaluation and management. 5. Blue tint, cyanosis. Here, the condition of bluish discoloration of the skin, known as cyanosis, during hypoxia is a direct consequence of oxygen deprivation in the body's tissues. This phenomenon occurs due to changes in the color of blood as it circulates through the body. To understand why cyanosis occurs, let's take a closer look at the role of oxygen in the blood. Blood that is rich in oxygen has a bright red color. This oxygen-rich blood flows from the lungs, where it has picked up oxygen and is pumped by the heart to various parts of the body through arteries. As oxygen is delivered to tissues and cells, it gets used up in metabolic processes. As a result, it releases oxygen and turns darker. In cases of hypoxia, where oxygen levels in the blood are significantly reduced, more blood with a bluish tint circulates through the body. It becomes more prominent, especially in areas where the blood vessels are closer to the skin's surface, such as the lips, fingertips, and nail beds. So, identify if this condition is a serious sign or not for proper consultation. 4. Rapid heart rate, tachycardia. In the context of hypoxia, tachycardia is a physiological response that the body initiates to cope with reduced oxygen levels. This increased heart rate is a part of the body's effort to compensate for the inadequate oxygen supply to various tissues and organs. When oxygen levels in the blood drop due to hypoxia, the body enters a state of alert. In response, the brain sends signals to the cardiovascular system to increase the heart rate. The primary goal of elevating the heart rate is to enhance the delivery of oxygen-rich blood to tissues. By pumping blood more rapidly, the heart tries to maximize the amount of oxygen that can be transported to the body's cells. This adaptive mechanism is the body's way of trying to meet the increased oxygen demand of tissues despite the low oxygen availability. In addition to increasing the oxygen supply, an elevated heart rate also helps to improve the removal of carbon dioxide, CO2, from the body. CO2 is a waste product of metabolism, and by increasing the heart rate, the body can transport more blood to the lungs for efficient exhalation of CO2. So get your signs checked before it's too late. 3. Fatigue and weakness. Feeling fatigue and weakness during hypoxia signifies low oxygen levels in the body's tissues and arises from the fundamental role that oxygen plays in generating energy for various bodily functions. As you know, oxygen is a key player in cellular respiration, a process that produces energy within cells. When oxygen levels drop due to hypoxia, cells struggle to generate energy efficiently. This energy shortage affects muscles, organs, and bodily systems, leading to feelings of fatigue and weakness. Furthermore, oxygen deficiency hampers brain function, impacting cognitive processes like decision-making, concentration, and coordination. This can lead to mental fatigue, confusion, and a sense of weakness. 2. Chest pain. The chest pain during hypoxia simply signifies low oxygen levels in the body's tissues. However, it can be attributed to a combination of factors. See, the heart's demand for oxygen is constant, so the mismatch between oxygen demand and supply can result in chest discomfort or pain, commonly referred to as angina. Moreover, for those with underlying heart issues like coronary artery disease, hypoxia can worsen the condition. This is because reduced oxygen levels further compromise blood flow to the heart muscles, increasing the risk of chest pain episodes. So guys, mind it, seeking immediate medical attention is paramount in such cases. 1. Headaches or leg pain. Experiencing headache or leg pain during hypoxia, which denotes low oxygen levels in the body's tissues. First, in the case of a headache, the brain is exquisitely sensitive to oxygen changes. As oxygen supply diminishes due to hypoxia, blood vessels within the brain may react by constricting or dilating to regulate blood flow. These changes in blood vessel diameter can trigger the onset of a headache. Secondly, the muscles in the legs can also be impacted by low oxygen levels. Even if there is no muscle activity, the muscles may experience heightened fatigue and cramping, resulting in pain. Additionally, the body's adaptive response to prioritize vital organs can lead to reduced blood flow to the extremities, potentially causing discomfort or pain in the legs. In both cases, the occurrence of headache or leg pain serves as a notable indicator that the body's oxygen supply is compromised. So recognizing these symptoms promptly is vital in preventing potential complications in your body. Thanks for watching the entire video. Please press that like, share, and subscribe button for more amazing content. Take care.